A very good morning to all of you. I am again happy to be back in the Noto session at ISOT. In fact, I've practically attended all Noto sessions in ISOT, and I hope to be doing that. I don't really fit into this session where they're talking of increasing transplants because I am generally, calling for prevention, because I feel without prevention, the transplant program is not going to lead us anywhere. So I discussed something yesterday also, and today also I'll be discussing my thoughts. So we'll discuss under these focus areas. We need to understand the link between lifestyle and the organ health. We need to talk about primordial prevention. Unfortunately, when you talk of prevention today, we talk of only secondary prevention, which means early detection and treatment. That is to prevent, complications. We never talk of the primordial prevention, which is even before the disease sets in. Somehow that's taken a total backseat. If you look at all organizations in the world, whether it is WHO, whether it's UNICEF, anybody who talks about health talks about early detection and treatment, early detection of cancer and treatment, early detection of hypertension and treatment, early detection of diabetes and treatment. There is absolutely no talk around the world about prevention before the disease sets in. We will also discuss something about promoting healthy habits to prevent organ failures, and we will talk about empowering healthcare professionals to drive that change. However, healthcare professionals don't have to be empowered, they have to take things in their hand, but that they will be able to take only if they start thinking about health first. If you think about the healthcare industry and the money associated with it, probably you will never be able to think about the health of the patient. So first we'll try and understand the links between lifestyle, organ health and well-being. We know the major organs and the common risk factors. This is not something new. All of us are aware of it. The major organs are, one thing, before I say major organs, virtually every organ of the body is affected. Human body is interconnected. There are no organ systems which are separate from each other. But yes, heart, the cardiovascular system, through atherosclerosis, liver, kidneys, lung, blood and pancreas, they bear the brunt. And risk factors which affect organ health, look at them carefully. Some of them you will find in the books, some of them you will not. Unhealthy diet, a completely reversed sleep cycle, where people are staying out through the night, whatever may be the reason, and sleeping till late hours in the day. Stress today is a major factor which is actually leading to organ failures, leading to diseases. Obesity, I don't know about the rest of the world, at least 40% of patients coming to my OPDs are obese. By the standards the WHO decides, or even if you want to dilute those standards, they are still obese. Then sedentary lifestyle, of course, that's there with the modernization coming in, with lifts, escalators available everywhere, with vehicles available. Nobody wants to walk even 100 meters to the nearest market. You want to take an auto or you want to take your car there. Then the other interesting thing is toxins. Toxins is a subject that I'll discuss a little bit in detail. We think of toxins in terms of alcohol, smoking. We think in terms of, pesticides. But we don't think of permitted additives in food. We don't think of the drugs that we are taking. Drugs means the modern medicine that we are taking. Prescriptions, a whole lot of them are unnecessary. We don't even think of, the food we are eating. Salt and sugar, they are toxins. But we are eating them more than what's required. Of course, hypertension and diabetes we understand. So understanding prevention, it is important. These risks are crucial to developing effective prevention strategies. Unless we understand these relationship between these risks and the NCDs, we will not be able to design prevention strategies. So key lifestyle factors affecting organ function. We know the impact of diet. A balanced diet provides essential nutrients which will support organ function and health. But every balanced diet cannot have a uniform description around the world. It has to be designed for individual country And within India, it has to be defined for individual regions. India is an extremely diverse country. It's very different from the world. Kerala will have a different, balanced diet. It may be based on coconut oil. There's nothing wrong with coconut oil. Similarly, Gujarat probably will have a diet defined in groundnut oil. North India would have a diet defined in mustard oil. Where does olive oil come in? Just because it is produced somewhere, it is expensive, it needs to be eaten. It's an absolute nonsense. We have good quality oils within India, but we have to realize what's good for our health. Physical activity benefits we know. Regular exercise is known to enhance circulation and organ efficiency, promoting better health. But that does not mean going to modern gymnasiums, enclosed spaces, air-conditioned rooms. It probably requires walk out into the open. A simple walk of about 4 to 5 kilometers will be better than any sort of gym. Cycling would be a better exercise than gym. But then the other aspect of it is, where is the place you would cycle? You look at the roads around the country, we don't have cycling tracks. We need to have them. That's the place where you need to invest in. But then, some people would say it's not good for economy. If people are not buying petrol, if people are not buying vehicles, it's not good for economy. Cycles are much cheaper. But I don't think that should remain. If you really want to work for the health, it doesn't really buy. Risks of smoking, alcohol, drugs and medication. I mentioned about toxins. So medications are also toxic. If I go and look at the Indian pharmacopoeia, every medicine prescribed has every side effect. And when I state that, I can put that in writing on a stamp paper. Every medicine has every side effect. What you read in books is only seen in about 1 to 10% of people. We go by those side effects. But any individual can develop any side effect. And it's a known fact that a single tablet of rifampicin or a single tablet of antibiotic can actually produce renal as well as hepatic failure by way of idiosyncratic reaction. That's not an unknown fact. Who would develop it? It's a question. Effect of stress, physical, mental as well as emotional. Chronic stress negatively affects immunity, organ function and overall health in a big way. It promotes pro-inflammatory chemicals within the body. It actually decreases your immunity through the central nervous system. We never think of that. And COVID was one big example where the press was, always after. So many deaths have occurred because of COVID. There are no beds available. And people were just panicking. That's not the reaction you have to, and that should have been controlled. That should have been controlled by all governments around the world. It should never have been allowed to run so negative. Coming to unhealthy versus healthy diet, it's not just about these two pictures, one showing, broccolis and the vegetables and the other showing burgers. It's much more than that. And we need to change our attitude towards food. We need to understand a simple fact. Food is for health, not just for taste. Unfortunately, today we have, just started listening to the taste buds of our tongue, not realizing what we are eating. The concept of healthy diet needs to be revisited. A healthy diet needn't be complicated. It doesn't have to be a 6 or 7 course meal. A simple meal that's available to a person could be nutritious. And I was talking yesterday, lentils and rice mixed together. Lentils and porridge mixed together would be the best probably balanced diet around, and that was taken in India for centuries. Yes, protein would be a little deficient. You could add a little bit of eggs and dairy to it. Then the other thing, food needs respect as well as time. If food is so nutritious for the human body, why don't we give it time? Why are we always hurrying our diet? We want to finish our food in 5 minutes and move on to something more useful, not realizing how useful the food is. Do we even understand the relationship between the food and the microbiome? This is one aspect which is totally ignored. We think we are eating food for the energy. Food has a very important role in actually restoring or maintaining the human microbiome, and we will need to realize the importance of microbiome in prevention of disease. I'll mention that in a later slide. And the last question, are we eating more than required? A section of the society is eating much more than required. And obesity is itself a disease. Excessive eating is itself a disease. The availability of food should not decide that you should be eating. It should be your own appetite, your own satiety, your own requirement. So, Continuing with unhealthy versus healthy diet, how many times should one eat? This is a question that is asked. And a thought had come from the West for some years back, small frequent meals. Those small frequent meals for healthy people makes no sense at all. It does not make any sense at all, because every time you eat, you are going to have your blood sugars raised. You are going to have hyperinsulinemia. It's going to be treacherous for your health. Hyperinsulinemia is a single factor which is responsible for a lot of problems regarding health. Similarly, when will your GI tract get some respite? It also needs rest. We know the gastric emptying time is a minimum of 2 hours. But that is for individual foods. Simple food, it will be 2 hours. If the diet is too complicated, it may be longer than that. And I don't know, Dr. Vivek was telling me there were 1500 people at the banquet dinner yesterday. And you know, one such banquet dinner you end up eating for at least 3 to 4 days. And next morning when you get up, you say that I'm feeling heavy, I puke or I have some nausea. You'll say I have food poisoning. It's not food poisoning, you've just eaten more. Be more careful about your eating and give rest. Timing of meals. Is breakfast essential? This is a very important concept. We believe, you know, somebody said, Adele Davis, she's a very controversial nutritionist of US. In about 1919, she said that eat breakfast like a king, lunch like a prince, and dinner like a pauper. She had some thoughts to it. She thought that the dinner which is eaten in the last, it's not utilized. You sleep after that, so it should be light. Indian concept was also like that. Indians used to have a dinner early, at about, before sunset, at about 5:30, 6 o'clock, depending on the sunset. So it used to give a long gap before the next meal in the morning. So who decided that breakfast is the most important meal? This is very interesting. It was not a doctor. It was Kellogg's. Kellogg's, when they started producing breakfast cereals, they decided that breakfast should be the heaviest meal in the morning because they wanted people to eat their cereals. Go back into the history and read that. So don't just follow blindly that eat breakfast like a king. So when should we have the first meal and when should be the last? I go back again to history. India was an agricultural country. The farmer used to go to the fields at about 5:30, 6 a.m. in the morning, empty stomach. His wife used to take the food at around 10 o'clock. That was the first meal they used to have. And the second meal was after coming back in the evening, before sunset. And health does not mean just longevity of life. People earlier died because of infectious disease because they didn't understand hygiene. But I don't think the concept that we had small frequent meals and we started eating 5 to 6 times a day, so we started living longer, that's a wrong concept. And even if I have a person staying, at longevity to 80 years of age, who is not able to look after himself, what is the use of that longevity? So unless that longevity is healthy, it's useless. Now, my last question here is, are professionals who are supposed to guide the patients themselves aware of these concepts? Unless they are aware, how will they answer the queries that the patients have to be answered? So what do these professionals like me, I say, do we know about diet, glycemic index and hyperinsulinemia? Human body likes a steady state of glucose. That blue line that is given is the steady state of glucose that the human body desires, requires, and that's required for good health of every organ. Now what happens is, every time we eat, there's going to be a spike. And higher that spike is, there will be a trough that follows which will be lower because the compensatory mechanisms of the body come into place. The body does not like these troughs and spikes. And this is bad for every organ of the human body. So you need to maintain a steady state. So there are food items that produce spikes, which are called high glycemic index food. However, the single most important factor that keeps the glycemic index under check is that if you chew your food properly, if it is mixed with saliva, if it goes into the stomach mixed with saliva, every food item's glycemic index is lowered. Now, I was actually in the process of developing some guidelines for patients, how we answer patients' queries through NCDC. And when I asked them to check on this fact, there are said no references available. Because those references are not allowed to come into forefront. But there are any number of papers which say that a food which is chewed between 50 and 30 times, which our ancestors used to say, you have 32 teeth in your mouth, chew every time 32 times before you swallow. So that food actually brings down the glycemic index, that improves the health quality. So every time there is a spike, there is a release of insulin which causes hyperinsulinemia, and hyperinsulinemia is responsible for diabetes, hypertension, lipid problems, and a host of other problems, including what we know in gynecology as PCOD. Then the other thing that I mentioned about, is abnormal sleep cycle. We have the so-called Brahm Muhurat, the divine hour, which is defined. It is not something unscientific, it's very scientific. If you compare it with the normal human circadian rhythms, it's absolutely related to it. Brahm Muhurat is around 4:30 a.m. in the morning. It's actually 1.5 to 2 hours before the sunrise. And that is the time the cortisol secretion in our body starts. So if we are going to reverse that, how are you expected to remain healthy? How are you expected to have less stress in organs? The human body is designed to function from dawn to dusk. You can't reverse it. You can't reverse it by saying that some of us are eagles and some of us are owls. That's flawed. You just want to, make it convenient for you because you stay awake in the night, you say, I'm an owl. No. The circadian rhythm is not designed according to whether you were an eagle or an owl. Now, how does health and disease relate? There are neuroendocrine factors which directly have an effect on the immunity. And there are also these neuroendocrine factors also have an effect on our metabolic status. And if we are going to reverse the sleep cycle, it's going to actually affect the brain. The brain has to sleep, has to rest from say 10 p.m. in the night to 2 a.m. in the morning. If you are going to stress it by keeping it awake at that time, it's going to affect these secretions badly and these functions badly. We know that obesity is harmful. We need to understand it's a disease. And I would want each one of you to tell that to your patients, that obesity is a disease. It's not a question of shaming anybody. There's so many health problems that are associated with obesity. You have type 2 diabetes, hypertension. I don't need to enumerate. All of us know it. Similarly, causes of obesity, genetics I think is blamed too often. There are a lot of other factors. There are processed foods, fast eating, sedentary lifestyle and poor sleep, hormonal imbalances, stress, emotional eating, snacking, medications. They are all related to development of obesity. Dr. Georgie, you told me it's okay. Please carry on. You have an oration. Thank you. So what happens if you have a happy brain or a depressed brain? These happy brains and depressed brains affect the entire body health. It's not a question of, taking medicines through a psychiatrist to make the depression all right. It will still not affect correctly your other organs. Just remember. And one of the greatest effects of this chronic stress is your gray matter in the brain decreases in size. It diminishes in size. So it would lead to a problem with the life as such. It is one of the causes of early onset dementia as well. Need to think more about it. Side effects of a sedentary lifestyle are also plenty. There are digestive issues. You go to a gastroenterologist, he will prescribe you drugs. Wherever the problem lies with the fact that you are not moving at all. You're just sitting the whole day. Poor circulation. Your cardiovascular, your respiratory effort decreases. It's a vicious cycle. You don't walk, you don't move, you don't exercise. Your reserve goes down. Of course, bone mass loss, poor mental health, obesity, as well as cervical and lumbar pain. Today when I look at my OPDs, I get 20-year-olds with cervical spondylosis, symptoms of cervical spondylosis. Why? Because they're sitting the whole day, either on a laptop or on a mobile or on a tablet. They're just not moving out. Toxins is a tricky issue because it may, hurt a lot of people. What we eat, I hope we are not eating a lot of toxins. What we drink, tobacco, alcohol and other habit-forming drugs, unnecessary prescription drugs I would implore everyone here who prescribes drugs to think before he prescribes what is essential, what is not essential. Don't make a whole list of long prescriptions for the patient. Then plastics. We have found microplastics in placenta of people. We found microplastics in layered rocks. So microplastics is something which through water, through a variety of sources can find their place anywhere. Are we looking at them as the cause of organ failures as well? We are blaming NaFLD. So environmental toxins, of course, they are easy to blame, air, water and soil. But where do these environmental toxins come from? They come from human activity. So unless we change our lifestyles, we are never going to be able to do it. So what we eat and drink today, look at this whole list of things here. These are the toxins that we're talking about. We need to look at that. Bottled water, present everywhere. Whether you are in the airlines, any place, you will get bottled water. Salt and beverages, of course. So these plastics find their way everywhere. They affect thyroid homeostasis, they affect the cardiovascular system, they affect allergies, and they accumulate in kidneys as well. Need to look at that carefully. Early detection and risk assessment we always talk about. I'll not discuss much in that. There are screening protocols, but most screening protocols should be either routine blood tests, which should be preceded by a good history taking. Imaging techniques like MRI and ultrasound, they do detect things early, but they overdiagnose as well. Sometimes we see abnormalities on MRI which may be normal for that particular individual. Functional assessments are important. So you need to utilize biomarkers also, but not without a history. You can't have a biomarker independent of history. Unless the history suggests, you can't use a biomarker. We talk of personalized care planning. It goes completely against the guideline based treatment that we are issuing. On the one hand, we are issuing guidelines to physicians. On the other hand, we are talking about personalized planning. They are opposite of each other. Every individual has to be treated separately and differently, and I will tell that going into the further slides. Let's be sensible about integrating technology as well. Wearable devices, they harm more than help. You are constantly thinking of your BP that will change with every heartbeat. Is that correct? I don't think so. Advanced diagnostics are important, but not as screening tools. Today there is a thought going around the world that all fevers should undergo a panel of 60 viral tests to say that which virus is involved. Tell me which virus is there and what treatment will you give? What is the point detecting a virus? Why burden the patient with that diagnostic tool? So we have to promote healthy habits. Nutrition and dietary requirements, I've already discussed the problems. Balanced diet has to be defined for every region. Physical activity guidelines have to be issued, but then simplest thing, please walk as much as you can. That's the simplest way I can tell anyone. But if you don't walk initially, you will not be able to walk in future. As the age increases, as your weight increases, walking becomes difficult. Weight management is important. It leads to metabolic improvement as well. Addressing substance abuse is very important. Somehow neither tobacco nor alcohol is ever hurt by increasing taxes. Some steps have been taken, for example, warnings about cancer. Similar warnings need to be put on food packages also. How do I empower the healthcare professionals to drive a change? There needs to be commitment, communication skills, they have to be human, they have to have compassion, competence, leadership and courage. Courage to tell the policy makers that you are wrong. If that courage is missing, probably nothing will change. So impart the right medical training on communication skills. Somehow some of these trainings are not imparted by the way of PowerPoint presentations. Communication skills will improve only when you start communicating. If you communicate only with your personal mobile device, with your personal tablet, those skills are never going to come in. Motivating healthcare professionals, restoring the confidence in the MBBS practitioner. We have somehow said that our general practitioner is useless. We need to go to a specialist. That's wrong. So patient education and engagement strategies, Motivating patients to adopt healthy lifestyles by adopting them yourself. You are an example. Encourage patients to sustain and enjoy the benefits of healthy lifestyles. Comprehensive healthcare is important, which means that prevention and treatment strategies have to go together. Same for transplant. A comprehensive care approach for every patient, a physician-based approach, not a specialist-based approach. Public health leaders are also supposed to look at that, to have community health programs, and your target population needs to start from schools. Unless you are targeting schools to tell the children about the healthy habits, they are going to grow into adults as well. Last, innovative approaches and future directions. Unfortunately, all research, development, novel diagnostics goes towards novel diagnostics and therapeutics. There is no research coming into prevention. Need to invest into prevention. Like you have, a corporate social responsibility. Industry should have a responsibility towards talking about prevention and investing in prevention. Personalized medicine for organ health. There is a need to maintain the human microbiome. Why I say that? The next two slides will mention that. You see, we differ only 0.1% in our genetic makeup. Any two individuals will differ from each other only 0.1% in their genetic makeup, but they differ 80 to 90% in their microbiome. 80 to 90% in their microbiome, and this microbiome is actually responsible for the different response to disease, different response to medicine, and immunity as well. So unless you take care of the microbiome, realize that you are a different individual based on that microbiome, you will never be able to manage health. We talk of building healthcare resilient, resilient healthcare systems. Should this be only increasing organ transplants, create more transplant centers? I believe performing transplant should be the last resort. Technology and AI cannot be an answer to all problems, even if we are able to manufacture artificial organs someday. There is a thought going on that we will manufacture organs in the laboratories. So far it's not really materialized. But when it will materialize, it will be too expensive. It will only increase the expense on healthcare. So a collaborative call to action for organ health, lifestyle changes are important. Early detection benefits will always be there, but that should not take us away from the fact that we have to prevent. Healthcare professionals are already empowered. They have to change their mindset. And innovative solutions have to go towards prevention on a long-term basis for the country. Thank you.